I think A is a waitress.
I thought she might be a makeup artist.
Works in a nail salon.
Yoga instructor?
Probably a secretary.
A hairstylist.
Picture B, I thought she might be an executive.
Secretary.
Hairstylist?
Dancer.
Maybe a waitress.
A makeup artist.
I thought she might be a CEO.
An executive.
A real estate agent.
School teacher.
A businesswoman.
I thought that the most beautiful was picture B because she reminded me of my niece.
C. I just went with the whole kind of conventional beauty, you know, pretty face, blonde hair, nice eyes.
C is the most beautiful. I actually like people with blonde hair, and she's got blonde hair.
Well, C is the most attractive because it has more of like a clean style and look.
A is the most attractive because her face is the most symmetrical.
C, I think just her makeup is in place and her hair is properly blow dried.
C is the most attractive. I do like blondes.
C is the most attractive. She's blonde. She's more of like the Hollywood stereotype of a leading lady.
Well, like it or not, it's true. People are being judged by the way they look. And one of the things we're talking about today is, does that happen? Should it happen? Why does it happen? One controversy that is really a big one right now is eyelid surgery. Now, take a look at this before shot of a girl with no fold in her eyelid. Okay, and now after, with the surgery that creates a flap, I guess, or a second flap in the eyelid. Now, it's one of the most common plastic surgery procedures for Asian women. Some say it's wrong, and others say, no, it's just making them prettier.
I'm Dr. Peter Newen. I'm a board-certified plastic surgeon in Orange County. The most common operations requested by my Asian American patients are upper eyelid surgery. There are always patients who would like to become more Caucasian. Most of my patients want to look just like they are right now, except a little bit prettier. What they would like is to have a upper eyelid fold created for them so that it will create an impression that their eyes are much bigger, more awake, and more alert. I believe that the presence of the fold to a significant number of Asian Americans is a sign of beauty. Look at this patient. This is a pretty good example of the typical kind of upper eyelid surgery. There's absolutely no fold, a lot of empty space between her eyebrow and her eyelashes. And I look at her face, my impression is that she's probably not that popular in the look department. You look at her eyes before, and her eyes look sexy after the surgery. They still look totally Asian. I think beauty absolutely matters. Everybody wants to see a pretty face. I found that, college students who are more attractive get better grades. People who are more attractive have higher salaries. Characteristics such as reliable, trustworthy, friendly, and the people who are unattractive get unfriendly, hostile, mean. If you look at all the movie stars, all the singing stars, most of them are attractive. That's why we value beauty, because it's pleasant. I think one of the most satisfying things to see is how happy patients are after their surgery. And I'm very happy that I've chosen this career.
Okay, now Dr. Newen is here along with Stephanie, who had the eyelid surgery, and also joining us in the debate is Deanna, who says, look, eyelid surgery is fake, it's anti-Asian, you're erasing ethnic markers. Martin says people who have ethnic surgery are turning away from their heritage. So, Dr. Newen, you think this is all just a question of beauty, it has nothing to do with ethnicity?
Dina have eyelid folds. I believe from her perspective that she didn't have the surgery done. And she looks Asian, she has the surgery, she still looks Asian. My patient comes in, look Asian before the surgery, and they look totally Asian after the surgery.
Okay, why did you do it?
Because I felt that had I done the procedure, that my eyes would look more like what I saw in the magazines, in the media, in the CoverGirl advertisements. They have more of a double fold.
But you said you wanted to have more of a Western look.
Absolutely.
In fact, you said you were ashamed of your eyes.
Of my eyes, absolutely. And that's why I went to the extreme to have the surgery done.
Yeah, that bugs me some. I don't know, what do you say?
What bugs me is who's defining what's better and what's beautiful. And too often, I think it is Western media, Western images, Western ideas of what's ideal. And I just wish we could get to a place where there's a different idea of beauty.
So Martin, what do you think about this?
I think the message you send by getting your eyes widened or the flap added is that, you know, you're changing to look to that because you think it looks better. Whether you believe that or not, whether you believe that Asian culture is, you know, not as pretty or Asian heritage isn't as beautiful, that doesn't matter, because what people are going to see is that you're getting your eyes made bigger and that you're buying into and maybe even voting by your actions to promote this Western notion of beauty instead of what you had inside.
Okay, now we have a staff member, Chastity, and this is how we got interested in this particular topic, Chastity, because tell us about your aunt and what she had to say.
Well,
and your aunt's right next to you there.
This is my aunt, Shalette. Just recently, my aunt and other family members have suggested that I need a nose job because my nose is too flat, and and they think that having some height on my nose would enhance my beauty.
Because you're Filipino, right?
I'm Filipino. A lot of Filipinos are born with flat noses.
Okay, and you said you're in Hollywood, you need to look better?
Yes, she works here and she's surrounded by a lot of beautiful women. And I've seen your wife on the screen and beautiful feature. And Chastity, I think it won't hurt if she add definition.
What did you say about it when she...
I was appalled. I didn't know that they were completely serious because all my life I've been teased. I always had a flat nose. My aunts and my mom especially, they would pinch my nose when I was younger. Hopefully it'll grow a little as you get older. Honestly.
So you going to get it done?
I'm fine. I'm good with the way I am.
Yeah.